I am a qualified orthopedic surgeon and work in the field of hip and knee replacement surgery as well as revision hip and knee replacement surgery. I am also specialized in pelvic and acetabular fracture management. I was a graduate of B.J.Medical College from Pune and also completed my MS Orthopedics from the University of Pune. I finished my education in 1996, and at that time there was a lot of colleagues who were in the vogue of traveling to either UK or USA for further education. So in 1996 I decided to try and go to UK for further education. We spent nearly 9 years studying there. I completed my complete training in UK to become a consultant. But at that stage I always felt that I wanted to come back to India. There were several reasons for it. One of the main reasons was I think India was developing very rapidly and the opportunities in India for healthcare as well as other technologies was much higher. So when we decided to come back, I could see that the hospital quality and the quality of care that was being provided in India is much better as compared to the time I had left to go to UK. So in 2007 we decided to come back and start practice in Pune. And the surgeries that we performed in England could be easily and at the same level be performed in India. We could provide the same quality of care to our patients, and I think from my personal point of view as well, my social life was much more fulfilling in India as compared to UK. So from both fronts, both professional as well as social front, I think it was an enjoyable decision to come back to India. And I'm fortunate enough to work in a hospital which provides care not only for affording patients, but we also look after patients who are poor, who cannot pay for their treatment. And we have a full-fledged charity wing which actually provides support for patients who are poor. We can do the same operation that we perform for an affording patient. So I think that gives us immense joy to offer each and every patient who comes to us the same quality of care without having to think of his affordability. There are lots of misconceptions about hip and knee replacement surgery. One of the major misconceptions is that this operation will not succeed, and lots of people come to me and they are scared. They feel that this operation is not going to work and they are now forced to have this surgery. I reassure such patients. I give them the confidence that out of 100, nearly 96-97% operations are successful, and which they are, and the patients will do extremely well. They also last very long. Patients have this worry that this operation is going to fail in a couple of years' time, but that happens very rarely. Nearly more than 95% of operations will be successful and will last for 15 to 20 years. So I try to work on these insecurities that the patients have, give them the facts. We also give them telephone numbers of our patients who've been operated and have been doing well. So patients talk to patients as well, and they, I think, gain more confidence once they talk to a lay person as well. There are lots of new technologies which have come into the field of joint replacement surgery. One of them is the technological advance, because we are operating on younger and younger patients. Some of my patients are only 14 and 15-year-old boys or brothers who had hip replacement. They suffered from very rare juvenile disease, or we can call it as a childhood deformity, which led them to have severe pain and arthritis in their hip joints. They were only 14 and 16 at that age, and both had severe pain. So we operated on them and they have done extremely well. And the technology which is available to us makes us use these products more confidently in such younger patients, because they can forget their pain and have a very fantastic and productive life in front of them. And we tell them that, look, because they are so young, they might have to face a revision operation in the future, but the technology is so good that even revision operations have got very good results and patient will do extremely well.